Bottom line, we don't have to worry about this one, right?
Well, obviously you need to take it seriously and do the kinds of things that the CDC and the Department of Homeland Security are doing. But this is not a major threat for the people in the United States, and this is not something that the citizens of the United States right now should be worried about.
So although we don't want people to be worried now, I think we need to realize that this could change. So right now, don't worry about it. Be more concerned about influenza, which is going into a second peak for the season, than coronavirus. But keep in mind that the coronavirus situation could change, which is the reason why we're taking it very seriously, because it could be a substantial threat. People wearing masks now is just not relevant. You don't need to be walking around with a mask right now. Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else.
And hopefully they would get a better mask than the drugstore sells?
Right. The drugstore masks that sell have a lot of loopholes in them that let the virus through.
Our shutting off travel from China and more recently travel from Europe has gone a long way to not seeding very, very intensively the virus in our country. Unfortunately, Italy did not do that. They had an open border. They let people in. And until they really knew they were in trouble, then the cat was out, the horse was out of the barn, and that was it.
I have confidence in Dr. Fauci at the National Institutes of Health, who has some further confidence in what we're doing. You should come to Chinatown. Precautions have been taken by our city. We know that there's a concern about tourism traveling all throughout the world, but we think it's very safe to be in Chinatown and hope that others will come. Prevention, prevention, prevention. We want people to be concerned and vigilant. However, we don't want them to be afraid.
Yeah, I think that the decision to do travel restrictions from China early on was, a controversial decision, because whenever you do travel restriction, there are always people who will give reasons why that's not the appropriate thing to do. Right. But it really did work for us. We had relatively few people who came in from China, and we were able to identify them, to do their isolation, and to contact trace. That really put us a step ahead of a swarm of people that might have come in, which would have made it very difficult for us to handle that.
So, Dr. Fauci, it's Saturday morning in America. People are waking up right now with real concerns about this. They want to go to malls and movies, maybe the gym as well. Should we be changing our habits, and if so, how?
No, right now, at this moment, there is no need to change anything that you're doing on a day-by-day basis. Right now, the risk is still low, but this could change.
The country as a whole, because we get asked that all the time, still remains at low risk. Now, I hearken back to the original decision that was made by the president of making sure that we knew the scenario that was going on in China. We prevented travel from China to the United States. If we had not done that, we would have had many, many more cases right here that we would have to be dealing with. It's never 100%. If you look at the totality of the cases that have been reported, particularly from China, about 75 to 80% of them would do really quite well. They would just sort of like a bad flu or a cold.
Question, and I think this has reminded people, I think, a little bit of just flu in general. Even the president the other day was surprised at that conference that this many people die of flu every year. Tens of thousands of people die of flu every year. And I think that that's jarring for people if they didn't recognize that.
The people in America do not get a flu shot, and the flu right now is far deadlier. So if you're freaked out at all about the coronavirus, you should be more concerned about the flu, and you can actually do something about it and get a flu shot.
15,000 people roughly have already died of the flu this season. A couple years ago, 60,000 people died of the flu.
If this cycles through, maybe even goes down a bit and comes back next year, that's when you get public health plus a vaccine. We hope this just goes away, burns itself out the way SARS did. But if it doesn't, and it cycles in a seasonal way, that's when a vaccine comes.
If you're under 50 and you're healthy, which is most New Yorkers, there's very little threat here. This disease, even if you were to get it, basically acts like a common cold or flu. And transmission is not that easy.
Working with President Trump on deciding to ban flights from China.
Yes, sir, I was.
Do you agree with that decision?
I do.
Do you think that decision saved lives, Dr. Fauci?
Yes, I do.
Do you agree with the decision when ultimately we saw spread in Europe, and then the president recommended that we extend that to Europe. Did you participate in that discussion?
I was actively involved in that discussion, sir.
Do you agree with that decision?
Yes, I do.
Do you think that decision saved lives?
Yes, I do.
Eventually, then, we saw the United Kingdom have an outbreak, and there had to be a tough decision made. Do we extend that to the United Kingdom? Were you part of that decision?
I was.
And do you agree with that decision as well?
I do.
Did that decision save lives?
Yes, it did.
When you look at the 15 days to slow the spread, initially it started at 15. Were you part of the decision to implement that decision?
I was very much involved in that.
Did that decision save lives, Dr. Fauci?
I believe it did.
Then when President Trump met with you and Dr. Birx to extend that another 30 days, do you agree with that decision that President Trump made to extend that?
Yes, I was very much involved, and I agree with it.
Did that decision save lives, Dr. Fauci?
I believe it did.
So I know we've heard a lot about disagreements. Clearly, there are many decisions made. In fact, there are many very internationally respected doctors that are involved in each of those decisions. Is that correct?
Yes.
By and large, would you say that you and President Trump have been in agreement on most of those decisions?
We were in agreement on virtually all of those.
I appreciate
But, you know,
that.
when in my discussions and the discussions of other task force members with the president, we're talking about the reality of what was going on. And then when we would get up in front of the press conferences, which were very, very common after our discussions with the president, he really didn't say anything different than we discussed when we were with him. So I may not be tuned in to the right thing that they're talking about, but I didn't really see any discrepancies between what he told us and what we told him and what he ultimately came out publicly and said.
So did you get a sense that he was or wasn't playing this down?
No, I didn't. I didn't get any sense that he was distorting anything. I mean, in my discussions with him, they were always straightforward about the concerns that we had. We related that to him. And when he would go out, I'd hear him discussing the same sort of things.
In that February 7th interview, it's clear that the president knows what the stakes are, but he's not sharing that with the public at that time.
Yes, this is the tragedy. A president of the United States has a duty to warn. The public will understand that, but if they get the feeling that they're not getting the truth, then you're going down the path of deceit and cover-up.